We do know that there's been a couple of states that have just had continual problems, so many problems with their exchanges that they have taken action that some would say is pretty drastic. What are they doing?
Yes. Well, Oregon and Hawaii, I believe, are just completely scratching their state exchanges. I mean, just the cost to enroll each individual is almost equivalent to the cost of the average subsidy amounts that each person on the exchange would receive. I mean, just the admin costs are equivalent to the subsidy amounts, which is kind of crazy if you think about it.
So after all of those millions of dollars were spent on their state exchanges, they're just shutting them down.
That's right. Yes, they're starting over again.
Pretty fascinating.
Yes.
So, Katherine, for those of us who are not experts in the healthcare field like you are, how should we be viewing all of the media that we hear about Obamacare? How should we judge? Is this a good thing? Is this a bad thing? Help us understand that.
Well, I mean, I think the implementation has definitely been poor, especially with healthcare.gov and its technological glitches and the other state exchanges that have had their problems. But what it comes down to is this law going to seriously reduce the number of insured? Are people going to have access to doctors that they never had before? I know the pre-existing condition dilemma was a problem, and that is a popular provision of the law where insurance companies can no longer deny people with costly health conditions. But I think that a better way to go is to not enforce all these taxes and mandates. I think a better way to go is to offer more of an a la carte menu of health plans that gives patients and people choice of what really is in their best interests.